15 minutes past 11. Good morning, Malaysia. Otto here with you up till 2 p.m. on TRAXX Momentum. As it is, of course, in recent years, fasting has gained significant popularity as a method for improving health, managing weight, and also others. However, fasting requires careful consideration, particularly when it comes to taking medication or supplements. And smart dosing while fasting refers to the practice of adjusting the timing and also dosage of medications, supplements, and also other nutrients as well in a way that supports the body's natural fasting process while maximizing health benefits as well. Now, it's not just about what you take, but when and how you take it that matters as well. So with us in the studio right now, we have Noradlina binti Rosemi. She's a pharmacist from Kuala Lumpur Hospital, and she's been in this industry for more than 10 years, since 2011, if I'm not mistaken. Yes. And thank you so much for coming to the studio.
Thank you for having me.
And for those of you who just joined in, we are currently live as well on Facebook as well as on TikTok. It's TRAXXfm Official. That's TRAXXfm OFFICIAL. Now, Adlina, I'm sure throughout your years in this industry, you've witnessed so many things, so many different kinds of people, and you can even identify those who actually lie about their dosages as well.
Yeah, of course. You can see from the adherence, from the way they tell about the medications. Actually, we can tell.
So please don't even try, okay? Anyway, moving on to today's little question that we have over here. Are Muslim patients undergoing medical treatment, all right, permitted to fast? Simple as that.
Yes, to answer the questions, actually these questions are very famous among the patients, especially when we are approaching Ramadan or in the Ramadan month. So this is very common among them. They will ask. To answer the question, yes, they can, but with some conditions. So actually fasting is the third pillar of Islam. In fact, it is specified in the word of Allah subhanahu wa ta'ala, which indicates, O faithful believers, you must fast, as was required of those who came before you, so that you may be virtuous. It's in Al-Baqarah, ayat 183. So actually, Islam gave flexibility when it comes to fasting, especially for those who are sick. So there is a rukhsah, what we call that rukhsah, which is a leniency of the Sharia norm for the fulfillment of this devotion. The responsibility to compensate the missed fast, what we call it qada, must be fulfilled in other months. So this is also stated in the words in Quran, which means the obligatory fast is a certain number of days. Anyone who is ill or traveling may break his fast, but an equal number of the days are to be made up. And upon those who are unable to fast are required to pay fidyah, which is to feed the poor, and whoever volunteers good, for example, excess, it is better for him. But to fast is best for you if only you know. Also in Al-Baqarah, ayat 184. So the most important thing here is not to stop taking medication without consulting your doctors or pharmacists. Especially to those chronic patients, they are encouraged to prepare and organize their medicines intake plan ahead of Ramadan by consulting the doctors and pharmacists. Anyone or any patients who are unsure on how to take their medication while fasting are recommended to seek advice from pharmacies at hospitals, health clinics, or any community pharmacies nearby.
Mm-hmm. Now, what medical conditions exempt a patient from fasting during Ramadan?
Well, there are some individuals and situations that have been exempted from fasting. Number one, for example, we have an ill person is permitted to break his fast if fasting increases his pain or slow the recovery from his illness, but it is obligatory for them to make it up once he is healthy. Pain here in this context refers to severe discomfort, which is precisely the type of pain that necessitates breaking the fast. It is possible if the patient continue his fasting, and it will do more harm than good or become sicker or take longer for them to recover. Another one is people who are unable to recover from a terminal disease or who are inherently frail are compelled to break their fast, and these individuals do not have to fast or to compensate the fast that they missed, but they only require to do fidyah must be paid to the poor or needy. There are also mothers, which we have pregnant mothers or breastfeeding mothers, nursing mothers, which they think that if they fast, it's either
gonna
harm herself or harm the baby, especially the breastfeeding moms, which they may be low intake of liquids throughout the day when they fast. So this one, they can skip or not fast during that day, but they have to pay fidya and also qada the puasa.
Well, there you go. A simple explanation from our guest here today. We're talking to, of course, Noradlina binti Rosemi, pharmacist at Hospital Kuala Lumpur. So should you have any questions for our good pharmacist here today, anything at all, just give us a call at 03-2282-5491 or 03-2282-4746. Alternatively, we are live on TikTok as well as on Facebook. You can just slot in your questions in the comments section over there. Like it, also repost it, and tell your friends about this current interview as well if you'd like to as well. So just before that, we're going to break for a short music break, and then after that, we're going to continue with today's little session on, of course, today's topic, smart dosing while fasting, right here on TRAXX. For now, Troy Sivan, Talk Me Down, right here on TRAXX. Good morning, Malaysia. It's Otto here with you up till 2 p.m. today on TRAXX Momentum. As it is, we are currently live on Facebook and TikTok at TRAXXfm Official, TRAXXfm, OFFICIAL. With here in the studio is a special guest from Kuala Lumpur Hospital, a pharmacist named Noradlina binti Rosemi. 11 years. She's been in the industry since 2011. Yes, 2011. And you've seen a lot, you've witnessed a lot, and you experienced a lot as well in this industry. Now, we're going to get back to that question in just a bit. I have so much things to ask you on air, which is very interesting as well, which we discussed off air.
Yeah.
But, of course, back to today's little question with regards to the topic, smart dosing while fasting. What various forms of medication are available, and which types do not break fast, and which ones do actually?
Yes, actually, this issue has been extensively debated by religious experts, and also there are diversion of opinions. But actually, our JAKIM, Department of Islamic Development of Malaysia, has published actually fasting guidelines for patients in 2013 that categorizes the varieties of medicines that invalidate fasting and vice versa. Okay, let's go to the medications, medicines or procedures that can invalidate the fasting. Number one, we have oral medicines, which can be in tablet forms, can be capsule forms or liquids, everything that you swallow, then that could invalidate the fasting. Number two, we have medicines that inserted into the vagina, including pessaries and also washing procedures. Number three, we have medicine that inserted into the anus, such as suppositories and also enemas. Number four, we have general anesthesia, which involves gas, and also inhaler medicine. But this inhaler, I'm going to save it up for later because there are two opinions on this. Let's move on to the medicine or procedure that do not invalidate fasting. We have number one, all sort of eardrops, eye drops, nasal drops. This one on the condition that is not reach the limit of eardrum. Number two, we have sublingual tablets, which the tablets that we put under our tongue, provided that it's not swallowed. Number three, we have all form of injection, whether administered through skin, muscle, joints, or blood vessel. These include your subcutaneous insulins, whether you have to take blood, so that is not going to invalidate your fasting. Number four, we have topical medications like creams or ointments that you put on your skins and also plaster. And number five, we have mouthwash. Number six, nasal spray medicine, provided that it's not inhaled. And last but not least, it's a local anesthetic or partial anesthesia. This one, basically, for the patients who are going through scope and whatnot, this is not going to invalidate the fasting. Okay, let's go to the inhalers.
Yes.
Like I said before, there are two distinct point of view regarding these inhalers. The first opinion saying that inhalers will invalidate the fast. How? It's when the components of the inhaler enter the stomach. Okay, so if it does happen, then it's going to invalidate the fast. And the second opinion says does not invalidate the fasting because a single inhaler spray contains only a few drops of water, which is comparable to gargling, so it is not going to invalidate the fast. Anyhow, it is up to the patient to make a decision whether or not, in their personal belief, whether or not it's going to break the fast or not. So basically, I would say for inhalers, as long as you do it the correct way, it's not going to swallow or inhale inside your stomach.
So your fasting, it will not
yes,
validate
it will not
fasting.
invalidate your fast.
Okay.
But if you are like confused, don't know, so you can adjust your dose of inhalers. Maybe you can take during a suhoor or after you break your fast. Or if ever you need an inhaler during the day, during your fasting time, if you do it correctly, it should not be invalidate the fast.
Now, you mentioned about the correct way or proper way to take medication while fasting. Given that different medicines require different dosage and schedules, such as 3 or 4 or 5 times a day,
Yes.
how should these be adjusted during Ramadan?
Okay, for individuals who are ill, fasting does not prevent them from receiving treatment. Actually, patients should just be aware of their own health and should be prepared to break their fast if the situation requires the patient to do so. So this is important because we want to avoid any unwanted side effects, okay? For patients with chronic conditions such as we have hypertension, diabetes and asthma are particularly at risk for failing to adhere to their treatment regimes during fasting because we have our fasting period and such circumstances can lead to disease complications. So I'm going to tell you this the general guide to taking medicine according to the meal times during the month of Ramadan. But patients are always advised to talk to their doctors or their pharmacists for further information before changing the time of their medications. Okay, let's go to the 1 time a day adjustment. Okay, during the Ramadan. We have before meal and we have after meal. So for before meal, they can take 1 hour before suhoor. So it's okay for them to take 1 hour before suhoor. But for after meal, they can take after suhoor or after iftar, after they break their fast. Okay, for 2 times daily, for before meal time, they can take 1 hour before suhoor or after iftar, like you just take before your main meals. Like maybe you just sip of water, take a 1 kurma, then you can have your medicine. Or if you are so hungry, then you just eat first, then you can take 2 hours after your iftar. Okay, what about after meal? Then it's okay to take after suhoor or after iftar. And for 3 times daily, okay, this one actually we can adjust accordingly. For before meal, we can do 1 hour before suhoor or after iftar, before taking main meal, same thing, or 2 hours after you take a main meals, after iftar and before bed. And for after meal, you can take after suhoor, after iftar and before bed. But the frequency of 3 times a day, this one you need to talk to your doctors because there are treatments that require certain intervals which you cannot adjust like that. So you need to talk to your doctors, see whether you have any alternative to replace the treatment. Okay? And for 4 times daily, it depends on type of disease. First, you need your doctor's opinions again because usually 4 times daily, the interval's about 6 hours. So it's not able for you to fast if the interval is very short like that. So anyhow, for medicine that need to be taken 3 or more times a day, sometimes the issue is, like I mentioned, is the frequency of taking the medicines. However, the necessity to change the type of medications to be taken is subject to the doctor's opinion, evaluation of the patient's condition in light of specific treatment-related criteria. If you don't have any alternative, then you have to follow the treatment as scheduled.
Yes, definitely. So it also depends on your medication, your situation,
Yes.
and also it's very complicated to do it alone. So always refer to the professionals to get professional advice and help as well. They are there for a reason, just like our guest here today, Adlina. Now, speaking of which, you've witnessed so many kinds of throughout your experience in the industry. What is the increase so far when it comes to patients that come to the pharmacy? What kind of conditions do they have?
We have a raise in a patient who has young hypertension.
My goodness.
Young diabetes. Yeah, this is also results of, unhealthy lifestyles and also, having to try everything which is viral on TikTok, on Instagram, and not having the balanced diet and meals. They just take everything, intake only without looking at the nutritious facts there.
So you're saying that throughout the years you've been working in HKL, you've seen a rise in hypertension in kids as well as in adults, as well as in diabetes as well.
In young patients.
In young patients.
Yeah.
How young are they?
It can be 20s.
20?
Yeah, in their 20s, they're already diagnosed with hypertension and also diabetes. Yeah.
Do we have enough medication to fulfill all these patients?
We always have enough. We try to fulfill the needs of the public. Yeah.
What are some of the reasons they give when it comes to this? What's the reasons that hypertension happens in them?
It could be from the diet, the meals that they have every day, and maybe control of their stress level. Maybe they're not getting enough rest. They're not getting enough sleep. That also could lead to the to the situations.
It's kind of interesting to find out that due to not enough sleep and worry, it leads to hypertension and also diabetes because sweet stuff
Yeah.
makes what's it called, endorphins or something, right? Makes us feel better, but actually it has adverse effects as well. But anyway, if you have any questions for our good guests here for today, you can always ask us on our socials at TRAXXfm official. We have Christina Chin says, hello, good morning, Otto and Miss Noradlina, binti Rosemi. Thank you so much for the greeting. We also have Najib Nawi says, good morning. Najib Nawi says, is it true that one's gastric will worsen if we fast? Is this old myth? Can be trusted at all?
Okay, fasting with a gastric patient, whenever they want to fast, they can have their gastric medication. They can take it daily. Normally, I have patients that take, gastric medications daily prior or before they fast. And make sure your meals are also correct. You cannot take all those spicy food.
Oh, yeah.
Oily food. Those can trigger your gastric more.
Yeah.
Yes.
So there you go. Okay, thank you so much to your question, Najib Nawi. Just want to say a quick hello to JMS on TikTok, as well as Christina Chin as well. So thank you so much. So once again, if you have any questions, let us know what you think and your thoughts on our socials at TRAXXfm official, or just give us a call at 0322825491 or 0322824746. We're talking to Noradlina binti Rosemi, pharmacist at the Kuala Lumpur Hospital, and our topic is smart dosing while fasting. So we're going to take a short break and we'll be right back. Good morning, Malaysia. Otto here with you on TRAXX Momentum. Special interview for today. We're talking about health and smart dosing while fasting. And in the studio, we have Noradlina, binti Rosemi. She's a pharmacist in Kuala Lumpur Hospital. She's been in the industry since 2011, and we're so excited to have her in the studio. And should you have any questions, the final one, of course, head over to our TikTok account or Facebook account right now. Leave a comment in the comment section and ask us or ask the pharmacist what is it that's ailing you currently as well. Okay, and of course the phone lines are open 0322825491 or 0322824746. Now, with regards to today's topic, what guidelines should diabetic patients follow to manage their condition safely while fasting?
Okay, for diabetic patients, they need to be extra careful during fasting in Ramadan because their blood sugar levels can drop too low, what we call hypoglycemia, and or get too high, hyperglycemia during fasting, which can be very dangerous. So for diabetic patients who take insulin injections, dose and time of insulin injection should be modified according to the doctor's instructions based on the blood sugar level test done prior to the fasting month. Okay, you need to consult your doctor or your pharmacist about taking medicines and insulin dosage during Ramadan because it can prevent blood sugar levels from becoming too low or too high. Okay, and I would like to also call diabetic patient to go get a proper health checkup for a comprehensive health evaluation and also participate in an educational program with doctors, dietitians, pharmacists, and also diabetes nurses to learn on how to fast safely and appropriately during the holy month of Ramadan. Let's look at some warning signs if you have low blood sugar levels. Number 1, you will feel shaky, dizzy or sweaty. Number 2, you will feel sudden hunger or irritability and also extreme fatigue. These are the signs and symptoms of low blood sugar. And also we should look at signs of high blood sugar. Number 1, you will feel thirsty all the time. Number 2, frequent urination. And number 3, you will have this blurry vision or extreme tiredness. Okay? When experiencing all these symptoms of hypoglycemia, hyperglycemia, or dehydration, it is advisable to break the fast straight away. And if the symptoms persist, you should get the treatment immediately. Yes.
That's a symptom for Otto, almost on a daily basis. I'm constantly thirsty at the same time hyperglycemia.
Then you should have checked on your sugar levels now.
Okay. So we're going to discuss that off air, all right? In the meantime, of course, what important precautions should patients actually consider when taking medication during fasting?
Okay, fasting is no doubt indeed beneficial to one's health. However, it is necessary to continue taking medicines, especially for chronic diseases, with minor modification and under the constant supervision of healthcare professionals. And we need to have this effective communication between patients and healthcare professionals. It is very crucial for ensuring the intake of quality medicines while patient is fasting. So you have a few things to keep in mind. Number 1, to plan ahead, to get a medication schedule sorted before Ramadan starts. Number 2, you need to stay hydrated, drink plenty of water between iftar and suhoor. And also, this is very important as well, to eat balanced diet. Yeah, must avoid overly salty, overly fried, and also sugary foods. And this is also very important to listen to your body. If you feel unwell, do not push yourself, and you shall break your fast if needed. Yeah, and then just to inform that all this information provided is a general guide, and there may be differences of opinion due to the method of maybe qiyas and the determination of law that differs between mazhab. Accordingly, the information provided is general information based on the legal views of Shari'i, mazhab, and fasting guidelines for patients in Jakim. Anyhow, if you all have any questions, can always reach out to us to our number in National Pharmacy Call Center and PCC at 1-800 6722, or you can always check out, now is the Instagram time, is the TikTok time, so you can always check out us in Kenali Ubat Anda on Facebook, Instagram and TikTok. We have plenty of health tips there.
Well, thank you so much to our guests here today, Noradlina binti Rosemi. Also to those who are online right now, thank you very much, Najib Nawi. So if you're having gastric issues and go to the pharmacy and get the proper diagnosis, then okay. But there are some people in some cases where they actually lie to you, right?
Yeah.
I mean, okay, then for yourself,
Yes,
right?
yes.
Out of context over here. For your sahur, what do you
Yes.
take?
I'll normally take boiled eggs or maybe fruits
Yep.
and vegetables. Yeah.
That's
I try to avoid all those, oily foods, salty foods. Those will make you,
Bloated. At the
yeah,
same time,
bloated during the
gastric.
yes,
Yeah?
gastric during the day.
And coffee does have that effect on you as well for certain people. So don't
Yes.
take coffee during your sahur and all that. All right. But anyway, that's just me. Of course, get for professional advice from your pharmacist, also to your local doctor on your health, particularly during this month of Ramadan. So please, take care of your health and take care of everything else that around you, particularly also on when it comes to your income, because normally hypertension and overeating all boils down to your stress levels. This could be because your underlying income is not that on par. But yeah, it's all about putting value towards yourself so that you can put yourself to a higher level and take care of yourself even better and have more time for yourself, which is very important. But anyway, thank you so much to our guest.
Thank you
Thank you
again.
for coming again. So hopefully we'll see you again anytime soon and give us more
Inshallah.
advice when it comes
Yes.
to medication.
Sure, no problem.
All right, so we're going to take a short break and then we'll have the news at the top of the hour. And then I'll be back after with the third hour of TRAXX Momentum. For now, Neil Sedaka, Laughter in the Rain.